Jack Kall.
Okay, thank you very much. Hello, I am Dr. Jack Kall, a practicing dentist for 46 years. I am the executive chair of the board of directors of the International Academy of Oral Medicine and Toxicology, or IAOMT. We are a nonprofit organization founded in 1984. Our 1,500 members are dentists, physicians, and researchers who investigate and communicate safe, science-based treatments to promote whole body health. Our motto is, "Show me the science." Much of our Academy's focus has been on the toxicology of materials used in dentistry. We are the largest organization devoted to this. We have especially focused on 3 commonly used toxic materials in dentistry. Number 1, mercury, a neurotoxin used in amalgam fillings. Number 2, bisphenol A, an endocrine disruptor used in sealants and composite fillings. And number 3, fluoride, used in rinses, toothpaste, varnishes, cements, and filling materials. They are all put directly into the mouth. Additionally, fluoride is used in modalities of direct ingestion in the form of fluoridated drinking water, fluoridated salt, and fluoride supplements. Next slide, please. For over 30 years, our organization has been sponsoring and funding research on fluoride's toxicity. We have been especially interested and very concerned about recently published studies regarding the neurotoxicity of fluoride, and therefore support the NTP systematic review. We're very disappointed that fluoride-promoting dental interests, both within the federal government and outside it, have been trying to influence the NTP's findings, not based on science, but in an effort to defend their misguided policy of promoting water fluoridation. Next slide, please. What are the NTP's key findings? Number 1, that human epidemiological evidence supports a conclusion of moderate confidence that fluoride is a developmental neurotoxin. Number 2, that no safe exposure threshold was found for fluoride's effect on IQ. And number 3, that fluoride exposures experienced by pregnant women and children in the US today are within the range where human studies have found reduced IQ. The report provides extensive detail on the over 150 human studies identified as relevant. The report used rigorous, pre-established methods to rate the quality of individual studies. The IAOMT agrees with the NTP conclusions. We believe the monograph should have been published on its intended public release date of May 18th, 2022. The revisions NTP made subsequent to it being blocked by fluoridation promoting divisions within HHS and the revisions suggested by the BSC working group will not alter the key findings. Any additional delays in declaring the report final are unjustified. The IAOMT hopes the BSC will support the incredible effort that the NTP scientific experts have put into this systematic review. We agree with the external peer reviewers who offered the following comments. What you have done is state-of-the-art, and the analysis itself is excellent, and you thoroughly address comments. And well done. And lastly, findings were interpreted objectively. Next slide, please. From both careful review of the evidence on the association between fluoride and tooth decay, those the countries without having fluoridated their water supply,
You have
as well
1 minute
as those,
left.
Okay, as well as those, again, countries either that have fluoridated their water supply or not, over the last 50 years, you can see the dramatic declines in both groups of countries. And this information is provided from the World Health Organization. Next slide, please. The precautionary principle reminds us that in the face of uncertain evidence, it is important to act in a manner that protects public health. Next slide, please. I close with the IAOMT's position on fluoride. Quote, in summary, given the elevated number of fluoride sources and the increased rates of fluoride intake in the American population, which have risen substantially since water fluoridation began in the 1940s, it has become a necessity to reduce and work toward eliminating avoidable sources of fluoride exposure, including water fluoridation, fluoride-containing dental materials, and other fluoridated products.
Your time is up. Thank you very much for your comments, and I'm going to ask BSC members if you have any clarifying questions.
Yes, good afternoon. I'm David Kennedy. I'm representing the Preventing Dental Health Association. And next slide. Let's move the slides along rapidly. We'd like, again, to echo Chris Naras's remarks that we appreciate the integrity of the BSC review and your willingness to follow the science. Next slide. Paradigms are hard to change, especially when there's money behind them. Lead was introduced in '29, and it's still in aviation fuels today. Next slide. Baby food, drinking fountains, etc. The old toxicology was if it didn't kill you, it wouldn't hurt you. That was disproven by more recent toxicology. A little bit of data will ruin a perfectly good theory. It should not take 50 years to get a deadly poison out of the water supply. But it does, and the reasons are obvious. Money. Next slide. The risk assessment we conducted, PADHA conducted in 1997 with 3 days of testimony, an army of scientists, and that same year included the same as you have. Next slide. The increased risk of fluoride with increased intake. Next slide. This is the Metropolitan Water District who invited Kathleen Thiessen. Next slide. Next slide. Infants get a lot of water. Next slide. Can you just keep moving along with me? Yeah, there you go. And so water intake, that's a log scale on the bottom. Next slide. Right there is the EPA's reference dose. Here's the water intake in milligrams per kilogram per day with fluoride. Next slide. From the National Academy of Science Review, these are the points where they've noted there is a departure point from health for neurotoxicity, dental fluorosis, skeletal fluorosis, glucose metabolism, and that you can see all of these are way above the EPA's reference dose, which brings to question whether the EPA succumbed to political pressure to come up with a false reference dose. Next slide. The known effect levels are exceeded by many of the population. Next slide, said Dr. Thiessen to the Metropolitan Water District before they added fluoride to 18 million people's water. In other words, the reference dose does not protect most. Next slide. Fluoride sources are included, as you did, and more people will exceed it. The list of adverse effects does not include cancer, and there's probably a cancer-promoting effect, if not a cancer-causing effect. Next slide. Next slide. Director of Laboratories said in 1956, next slide. It's obvious from the knowledge of fluoride toxicity that such factors of safety cannot be established when fluoride is added to the public water supply at the level recommended by the proponent of fluoridation. Next slide. It must be concluded that the fluoridation of public water supplies is a hazardous procedure. People are bound to get hurt. It remains to find out how many and when. That you have begun to identify one of the causes for the disruption in our society today with children with learning disorders, ATD, ADSD, and all manner of neurological impairment. There is no reason to put a neurotoxin in the water supply unless you have a lot of it to get rid of. Who would that be? That would be our military. It's a byproduct, hydrofluorosilicic acid, of making nuclear weapons. That's why we get the big pushback from our military industrial complex who have captured agencies in our government. The CDC,
You have 1 minute left.
Dental directors, thank you. All dental directors throughout the United States perceive as their duty to promote fluoridation. We could save hundreds of millions of dollars every year by simply firing all of those people who think it's their job to destroy this country with chemicals in the water supply and instead promote hygiene and oral health with using natural products and good food, free of contaminants, pesticides, and toxins. And I thank you very much for your attention, and thank you for following the science. It's really clear, has been for a long time, and you've identified it for the rest of the public to understand. Thank you.
Thank you for your comments. I'll ask the Board of Scientific Counselors if you have any clarifying questions. And I don't see any hands raised, so thank you, Mr. Kennedy.